Hello, everybody, and welcome back to another episode of Off-Label Careers, the podcast where we explore different career paths into big pharma. Joining us today, we have an extra very special guest, Tosin.
Hey, my name is Tosin, and thank you for having me on, Safi. This is going to be a very fun time.
Thank you for being here, Tosin. Now,
Mm.
for those of you who don't know, Tosin and I actually went to undergrad together. I've known him since first year, so it's been, 4 years now,
Yeah, oh my gosh, it
right?
has.
And now we happen to work at the same top 5 big pharma company, but we took some very different paths to get here. Tosin, I'm very curious on hearing about your path, and I'm sure the viewers are as well. Can you please tell us a little bit about yourself?
So my name is Tosin Kasumu. I am just completing my fourth year undergraduate degree at the University of Toronto, where I double majored in human biology and psychology and did a minor in English, if anyone thinks about a minor. And in my pathway to where I'm at now is a bit like unorthodox, I guess. I started as pre-med. I feel like everyone starts as pre-med when they do biology. Um, and then I quickly realized that, oh, I do not actually want to do this. What can I do? And naturally, that kind of led to a bit of a jagged path. I started doing research a bit of everywhere. I started at social work. I did research at the Faculty of Social Work at University of Toronto. I did research at the University of Toronto Medical School, Tamarti, for 2 years. Um, I did research in the Department of Psychology. I did two research assistantships there, one in reproducibility sciences and the other in more like cultural psychology. And then afterwards, I did a brief AI internship at a AI company, and I then worked at the hospital known as CAMH, the Center for uh, Addiction and Mental Health, where I did a human factors project, and I did two. Well, I'm a part of two human factors projects. The first one was looking at ways anthropomorphism influences uh, clinician reliance. So what that essentially means is like we're looking at AI implementation studies. So how does anthropomorphism, how human-like an AI influence a clinician's trust in it? And then the next study, which was now being funded by a research grant, is what social factors influence clinicians' reliance on AI. So if I were to be like, oh, this AI is amazing, does that increase your reliance on them? So that's where I'm at now. I also am at. Uh,
It's okay. It's okay.
I'm
I'll cut it. I'll cut it.
okay. I'm also at a top five big pharma company, which is lovely, where I work as a pharma tech analyst, and I've been able to further explore that AI niche that I have.
Interesting. Pharma tech analyst. Now, before we get into that, as we see quite the academic journey, before I unpack that though, I think there's a side of you that most people do not know about, especially in our classes. You have a TikTok account, and not just any TikTok account, one with 17 million likes and 34,000 followers. Did I get that number wrong? Or
No, you got it right.
so what kind of content are you making, man?
Oh, so I make a bit of everything. I I believe saying no is a bad state of mind. You have to say yes to everything. So you have to try everything. You have to dabble. You can only grow by experience. So I tried some like skits. I tried some like food blogging. I tried some like day in the lives. I dabble. But I relatively stay around comedy, but that has also changed. It's now kind of like just like internet takes, I guess. Like, yeah.
Yeah, fair. No, dude, you're being way too humble. I saw you got invited to like this open AI TikTok event, right? You're
Yeah,
rubbing shoulders with some big influencers.
I now I know why you brought me here. Oh my gosh. I did. I was invited to be a TikTok partner for 2025, and that led me to be able to get invited to that event. It was amazing. There were like hundreds of people. It was in Toronto, downtown. We got a fully like it was the works. Like the food there was top notch. But yeah, it was an amazing experience. I got to learn a lot about how to apply AI to my own content creation career, which I did not realize I could do. I didn't realize the ways that AI could optimize content. Very interesting. I know that's very controversial. I know a lot of people do not like applying AI to their content. I don't, but like I do think that in setting up a career for yourself, AI is an incredibly useful tool.
Interesting.
Yeah.
So there's this creative side of you as well. Did that happen to influence any of your academic journey?
It did actually. My first research assistantship at the Faculty of Social Work was mainly knowledge translation. I was helping communicate this like really abstract research study to long-term care homes. I was helping create banners. I was helping emailing. I was helping. Okay, what is the narrative of this study that we want to push to these hospitals? So that was initially my role. Obviously, it teetered more into the research aspect of it where I was doing qualitative interviews, but I did start out in that creative place. I got an amazing experience at the Faculty of Medicine at UofT where I was able to be a part of a workshop about research storytelling, specifically digital research storytelling, where we created a video. My lab created a video about the travesty that's happening right now in Canada, where children who come from multilingualistic homes are getting screened for disability when they're not disabled because they don't know English. Like, if you don't know English and you're being tested on English, then how are you going to pass the test? How do we know that you don't know English versus like you just having cognitive deficits? It's a very interesting dilemma a very diverse place like Toronto is having.
Yeah. And you got this in around your third year?
I got this in my second year.
Second year. Whoa, okay.
Yeah. I very much was kind of similar to you. I know that I don't know if they know about your own pathway, but I was very much a go-getter. I wanted to experience as much as possible in my 4 years. 4 years passes by incredibly fast. I mean, like I'm almost done it. Um, And I think one thing, any advice is to anyone watching who's like starting out is go for it. Like go trailblazing for it.
And how exactly did you make that path? How did you get into these research projects?
How I got to the okay, this is like my biggest philosophy in life. Like I will say this, I will die by this. Closed mouths don't get fed. You have to be the person who emails first. You have to be the person who messages someone on LinkedIn. You have to be the person who like you see your teacher just about and be like, oh my gosh, like wait, like I'm actually really interested in the work you're doing, et cetera, et cetera. I think that so many people get really caught up in like appearing a certain way or not wanting to appear desperate, but the reality of the situation is if you're a first year undergraduate student, you are desperate. You don't have anything to offer them. So why are you coming in with the ego about not wanting to ask them or not wanting to appear some type of way? I've never understood that. Another thing about closed mouths don't get fed is that you also don't, when you start asking these professors or when you start asking for opportunities, you don't realize this, but a lot of people actually don't. So you end up differentiating yourself a lot. You are the first, when you're the first person to be like, oh, what can I do in this aspect? How can I innovate? How can I be a part of this? It sets you apart. People don't realize how big of a thing that is. It really truly does set you apart. It's a big differentiator. I feel like a lot of Gen Z is very shy, and if you set yourself apart from them and you ask questions and you follow up and you show that initiative, it moves mountains. I don't know what to say.
And it only gets easier after that. All
Yeah,
this practice in undergrad, it's serving well here,
yeah,
networking here in a company, and it's not just within the company, globally as well. You're talking
mhm,
to people from like Switzerland, from America,
mhm,
right? So we'll get into all the company stuff later, right?
yeah,
So I believe that you recently presented research on how giving an AI human face or name can change how clinicians trust it,
yeah.
correct? That's fascinating. Can you explain that to the audience? Like why does it matter if AI has a human name?
Oh, okay. This is where like I things start to get really interesting and things start to like really start to materialize. Essentially, why it's so important. This was a part of my research at CAMH. Why it's so important and why it's so important to look at the human factors of how reliance is made and how clinicians form reliance on these AI systems is that these AI systems are not perfect. They're built on flawed data. Research shows that a lot of clinical data has a lot of racial and gender bias in it, right? If the data for years and years and years believed or interpreted like POC, like us, as to be more resistant to pain, right? An AI system would take that data and reproduce it. So looking at those things when introducing AI with a name, when introducing AI to your friend, when introducing AI when you're already stressed out is incredibly important because those things also change our reluctancy to certain things, our resistance to certain things. If an AI system is presented with a name or with a face, how might that ease someone to trusting those biased AI outputs, right? That's where that important piece is. That's why it's so dangerous on giving AI systems a name or a face, or that's why it's so dangerous to not think critically about how we're implementing AI into our everyday lives. Yeah.
Interesting. Dude, how did you get into AI while doing a pure science degree?
So how I got into AI and how I got into um, pharmaceutical industry, the biotechnology industry, was kind of seeing that my like initial one-on-one efforts in medicine and in a long-term care home, that's where I did my most of my social work research, was not enough. I felt that I would help a resident one day and then the next day I would see that there were five other residents who also equally needed my help. And I realized that I wanted to do something more on a system-wide basis. How could I help people system-wide? You know, how could I help not just one person? How could I help thousands? How could I help millions potentially? And when I realized that that's what I wanted to do, that's when the my interests also changed. My interest in science or my interest in more clinical care changed into my interest into technology implementation, and that led me to start like looking and applying. I looked on LinkedIn, I saw a really cool lab, and I coffee chatted the lab PI, and I got into CABH. That's what happened. And through that, I was able to build expertise, knowledge, skills. I can now code. Me a few years ago would have looked at coding and been like, what is that? So little things like that. And that's again where that piece of closed mouths don't get fed comes up in. Like if you don't put yourself out for these opportunities will not present themselves. You know, the world will not know that you're interested in something if you never have the strength to voice it. That's just the truth.
Yeah. And it's
Yeah.
important to try as well. Like I remember our first year, like our stats courses, remember we were using R?
Yeah.
We had no clue what was going
No,
on, dude.
it was very spooky. It was
And
very
now
spooky.
he's here working and coding AI itself.
Yes. It's very fun.
It's doable. So that was in uni, and
Hmm.
now you are a pharma technical analyst intern at a global pharmaceutical company.
Hmm.
What does it actually mean day to day?
Day to day.
Are
So
you
I've
are you coding? Are you analyzing data, or like are you looking at more big picture strategy? What exactly are you doing?
Okay, so I think we need to go a bit more high level. I don't know how many people are aware of what a pharmatech analyst even is, so let me introduce that concept first. A pharmatech analyst deals with the commercialization of products, right? So they may deal with the operation side of it, of like, okay, we're introducing this new product. How can we do that? Are we looking how supply wise are we dealing with that? How regulatory wise are we dealing with that? How quality wise are we dealing with that, right? So from there, you can then niche down and imagine what my role would end up looking like depending on what specifically I'm doing. If I was in supply chain, I'd be doing what a like someone who works in supply chain does. I would be looking at logistics. I'd be probably using Excel a lot more than I currently do. If I was to be working as a pharma technical analyst in regulatory, I'd be looking a lot more in submissions. I would be looking at global product submissions. I'd be looking at country submissions. It changes place to place. But for me specifically, my role, because I have such an AI focus and because I've put myself out as someone who is AI forward, I deal a lot with AI implementation. I've been working in building gap assessment tools powered by AI. I've been working on AI chatbots, building AI chatbots from the ground up. I have been working on communicating and knowledge dissemination tools surrounding current AI tools that we have at the biopharmaceutical company that we currently work on. So that's like a bit of my day to day. I don't know if that's you would like me to get niche or if you have any questions about that.
Like, so just to kind of simplify things a little
Mm-hmm.
bit for the viewers, pharma technical itself is after drug gets approved, the commercialization, so how to get it
Yes.
to the people.
Yes.
And that involves various components like going through regulatory loopholes, like talking with the
Yes.
government, getting things approved.
Yes.
That's one aspect. There's supply chain,
Yes.
the actual logistics and getting it out.
Yeah.
And there's some other components as well, right?
Yes.
So that's pharma technical itself. You are taking a more analyst role.
Yes.
So what you are looking at is problems in any of those sectors.
Yes. 100%.
And even more niche is you want to look for AI driven solutions to those.
Yes.
Okay, not all pharma technical analysts are AI driven.
Yes.
Is that true?
That is true.
Okay, it's like some of your coworkers, are they in a similar thing as you, or how are they, like, what's the difference between what other types of pharma technical analysts are there is what I'm asking.
There's a bunch. There's ones who work in STEM and gene therapy. There's ones, like I said, who work in quality, regulatory. There's ones who work in clinical supply chain, which is its whole other beast.
Mm-hmm.
There's ones who work in supply chain. There's ones who work in operations where they never even like touch certain things. They're working within making sure that pharma tech operates. There's ones who work in communications as pharma technical analysts. There's a lot of different roles and different functions within pharma technical.
Okay. And this is something that's exists in a lot of pharma companies or in only a few?
It depends on the company. Some company, a bigger, larger size company like ours, does have a pharma tech department, but smaller ones may not. So smaller ones may have a more streamlined process of commercialization.
Okay. And it sounds like this type of role, you need to be very knowledgeable in multiple areas
Hmm.
because you're analyzing multiple different sectors of the pharma technical space.
Yes.
But are there any common technical skills or things, like how is someone supposed to prep for this if
How is
if they want to be an asset in this role?
To be an asset in this role, I would say being detail orientated is a thing. Having not like necessarily the most like amazing quantitative abilities, but you need to know how to run Excel. You need to know have like a basis of code. You need to have a basis of knowledge in the biosphere. A lot of people try to pivot into the space without having an idea of like what a biologic is, and if you don't know what that is, you're going to not struggle, but like you're going to have to a big learning curve. That's what I like to call it. So there's that as well. To prepare for this role, it's honestly one of those positions where you have to be dropped into it to learn it. I wouldn't. I come from a very distinct background. I know people who come from bioengineering backgrounds who land in it. I know someone who did psychology and ended up in it. It's very multifaceted. It's very different. I know someone. My manager did history. It's honestly like,
Really?
yeah,
Wow.
it's very much one of those roles where you get dropped into it and you either sink or swim. But I think the people who do swim tend to be very, very detail oriented, tend to be very good at problem solving, tend to know how to cultivate a good culture, a good team, know how to organize a good team, and know how to work with other teams really effectively.
Okay.
Yeah.
Now, let's talk about how you were dropped into it. It
Mm.
wasn't just to go on LinkedIn, apply, and get in, right? There's
Mm-hmm.
a little bit more to that. Like, people, you're an inspiring path. If
Mm-hmm.
people want to follow that path, what exactly did you do to get into this role?
To get into this role? Well, as I've stated throughout this little chat, I would say closed mouths don't get fed. I wouldn't have even known about the company I work at currently if I didn't have wonderful friends like you who like would be like, oh, like this company is amazing. They're doing X, Y, Z. I again, I wouldn't know about this role if I didn't do a previous role before it, where I worked as a market access intern and I grew a bit of more of that like schema of what biotechnology is, what pharmaceutical company is, what does drug reimbursement look like, what is this field, what are things that I need to know about this field, and what are the departments like.
Tell me more about the market access internship.
The market, oh, that was a very fun time. I was able to grow the kind of schema of biotechnology that I had because I do feel like a lot of university students are not properly prepared or trained for the real world. You are peddled to kind of either become pre-med or pre-academia. There's very little wiggle room of what is actually out there, the big wealth of opportunities that are actually out there, like industry, like biotech, like pharmaceuticals, like not even just like pre-med. There's also like rehabilitative med where you're working as a OT, a PT, an SLP, a therapist. Like there's a huge portion of health that gets neglected, and that internship was kind of my way of bridging that knowledge gap of what is biotech, what is it really, how do drugs work, what is a drug reimbursement, what is an SLP, like little things like that where it's like I had to learn that through that internship.
Was that part of the pill program?
Yes, yes. My university co-piloted a program for specifically for this purpose of preparing undergraduate students for the real world. And I learned a lot through it, and it kind of gave me the platform of being like, okay, this is something I want to do. How can I do that? There's internships. Let me start applying for internships. Let me start putting myself there immediately. And when I was applying for internships specifically, I made sure I was the first one to apply. I made sure that my application, if it might not have been the most competitive, but it will be the first one to be seen. You will at least get eyes on my resume.
Yeah.
Mhm.
There's a little saying we have in the drug industry where when you approve or you're getting new drugs to market, it's always better to be the first one out there than the best one out there.
Mhm.
So I think that also applies when you're job hunting as well.
100%.
For people that are currently in undergrad and maybe even the pill program, it's at UofT, correct?
Mhm.
Like UTM or St. George or
It's in UofT
UofT in general.
Global. Yeah.
How did you find out about that and how was the application process for that one?
That is, I would say again, kind of like what you touched on. Um, you have to be hungry for it. I was going to smooth over how much work I put in into finding that program, but you have to be hungry for it. If do you want an internship? Do you want to work in the industry? You have to be constantly looking. You have to be looking on LinkedIn. You have to be looking on Instagram. You have to be searching for these opportunities. You No one's going to tell you. Very much similar in a way that closed mouths don't get fed. Well, like people are not going to be just giving you free information if they don't know you're interested or if you're not showing that you're interested. You know, I think that's how one thing I would tell them. I would say, if you're truly interested in this, if you're watching this video and you're like, I really want to get into the biotech industry, then start applying. What's stopping you from applying? What is stopping you from preparing your resume and applying?
Yeah.
Nothing.
Every
Yeah.
summer we have interns that are in their first year, second year, third year.
Mhm.
It varies. You don't have to be grad school like me.
Mhm.
You can be even an undergrad.
Yeah, I'm an undergrad.
Exactly. Um, so from pill program, you did market access internship.
Mhm.
How'd you like that?
I loved it.
You love the market
Yeah,
access?
it was
Okay,
great.
perfect. Compared to now as pharma technical analyst, what are you leaning towards more?
I love market access, but pharmatech let me explore that interest of AI, of technological implementation, and that was something really, really important to me. So I have to go with pharmatech.
Okay, makes
Yeah,
sense.
sorry,
Uh,
sorry.
to all the market access people out there, don't worry, we still need you.
I might be in that field eventually. You never know. um,
And yeah, so that was in when did you do the pill program? Third year?
third year.
Third year. That was 4 months.
Hmm.
4 months, and then you finished the pill program. That was your first big gateway into the biopharmaceutical industry. You
Hmm.
learned about all the terminology, the
Hmm.
processes, and then how long before you applied to Roche? So you applied here. How'd you apply to? How'd you apply to the top five big pharma company after?
So your question is how I applied to a top five, but
Here, yeah, for
okay,
pharma technical.
for a pharma tech. Um, to be honest, this was my first round ever applying to like official big boy internships. You might say. How long that process took? It took And 4 months after like applying, I got a interview. I prepped well for the interview. That's another thing people don't tell you. Do not show up at that interview not knowing stuff. There is a difference. Everyone who works here says that there's a difference between interviewees who have prepped and interviewees who came up and were like, "Oh, I'm gonna win them over via vibes." So that's another thing I would say.
Is this? Let me just check your mic. Is it on? Point it towards me. Yep. Okay, we're good.
Yeah.
So, tell me about the interview. How did you prep, and what did they ask you?
They asked me basically like the basics of like strengths, weaknesses, how do you communicate, if a problem's presented in front of you, how would you solve it? I would say the best piece of advice for tackling such internships, not internships, interviews, would be having an experience that you can shape and contort. If you had a great experience presenting at a conference, then how can that conference experience highlight a skill that you might be really proud of? How could that conference experience highlight an area of when you encountered an issue? How can things like that? You need to map out your experiences, and then once you've mapped them out, they tend to be very malleable in ways you can answer questions.
Okay, makes sense. And now you're here.
Mm-hmm.
Now, throughout from what you've learned here and even in your past research experiences, you've
Mm-hmm.
been studying AI very, very closely.
Mm-hmm.
What do you think about AI's future, next 5 to 10 years? Is everyone's jobs getting replaced?
Okay, not that everyone's jobs are getting replaced. I think the future of medicine might look a bit different. My like little like not to get like AI like determinists or like oh AI is taking over, but I do think the way that we interact with medicine might change forever. Not forever, but it will change drastically. I don't think this is going to happen in 5 to 10 years. I think a more realistic timeline would be 10 to 20. But with the amount of medical devices that already track your heart rate, your health vitals, I think it's only a matter of time between that meets AI, and we then get into predictive health. And that's actually a technology that is already being implemented called digital twins. A digital twin, in theory, can be your AI copy that you can run simulations of okay, if I smoked for the next 25 years, what would be my health outcomes? Things like that. And I think that is going to change the role of doctor into a lot more of a consultant role. You go to your doctor if you're seeing that you're down a bad health path, or you're going to your doctor if you yourself, the tech that you have, can't really identify what's going on with you. It's going to be a very specialized role. That's how I figure it is going to change. I also figured that the barrier to entry may lower a bit for doctors, so we might see that bit of that prestige get roughed it off. If you have a AI decision support tool, how much education does that person realistically need to have? Is there going to be a barrier or of like, oh, this is a doctor, this is a nurse? If a nurse does everything a doctor can do and now has an AI decision support tool, why doesn't that merge together? And it's like, okay, now this nurse can prescribe you with things. Now this nurse can diagnose you, little things like that. I see a despecialization, like I see that, okay, people are not going to be either as nearly as specialized as they are, or I see like people are going to get hyper specialized. And I also see that kind of like consultant model working.
Okay. So with that, the education also needs to change. Like
Yes,
the skills that are useful now won't necessarily be useful later, but that
100%.
doesn't mean that more skills are gonna not gonna be needed.
Oh,
Like
100%. I think a lot of skills are going to be highlighted more. I think bedside manner is going to become a lot more of an important thing. I think little quality of life skills, for example, like can you do a suture really nicely? Can you draw blood in a way that makes a patient comfortable? Little things like that are going to become a lot more important as this kind of standardization of the healthcare system occurs. If a robot can do everything a doctor can do, then why would you go to a human doctor for that human element? That's what I see happening. And you touched on something that I find is also going to change in a lot, specifically in the next 5 years. that being medical education. I think medical education is going to look completely different. If you have an AI tool that you can deploy as a pseudo patient, then why would you test real patients? If you have an AI system that reacts like a human body, then would you still need cadavers? Of course, I don't have all the answers, but I do think that the way that we envision the hospital, the way we envision doctor appointments, the way we envision medical education are all going to change with AI. I think we've kind of unleashed Pandora's box and we won't really know what happens until it happens.
It's okay. Life's just getting started. You just finished your last exams, or are you still having any?
I'm
He's
done.
done.
I'm
Okay,
done.
graduated.
Freedom,
Let's go.
freedom, freedom.
Amazing.
Uh,
Just to wrap it up,
mhm,
if you were talking to first year Tosin, just
mhm,
stepped into UofT, a student who is stressing out because all they see is either medicine or research,
mhm,
and they love biology, they don't know, like technology is very foreign. What sort of advice would you give to them?
mhm. I would say you are young, use that youth to gain as much experience as possible. If you do not know what you want to do, now is not the time to be comfortable in your decisions. Now is the time to really experiment, to really try everything, to really see who you are, and to really go after what your interests are. If you're interested in biology, okay, then look at some stem cell work, look into biotechnology. If you're interested in psychology, look at psychotherapists, look at social work, look at human factor engineering, look at everything those two fields really have to offer. I think so many people who are kind of ambivalent about their degrees or kind of don't know their next steps tend to pigeonhole themselves with like, okay, this is familiar, I'm going to stick by this, rather than exploring. You won't grow unless you explore. You won't know what's out there until you've seen it. um, and that's my piece of advice for that first year Tosin who's wondering what's out there.
Amazing,
Yeah.
amazing advice. Thank you so much.
Hmm.
Now, bit of a maybe uncomfortable question. What's your next move? You graduated. What's next?
I don't know. I think I'm gonna probably work more, do a master's. I can't give that piece of advice and say explore and not explore myself. I think, as you've kind of mentioned and highlighted through this interview, I'm involved in a lot of stuff and I want to continue to be involved in a lot of stuff. And I think my career is going to look a lot more like a portfolio career where I'm involved in a bunch of different high level tasks rather than having a streamlined career path of, oh, I am this. I'm a product owner or whatever. I think it's going to be, oh, I do content creation. I'm super passionate about AI. I um, also love health. I'm also super involved in drugs. Like that, I think is going to stay. I think that idea of portfolio careers should be propelled to more people as well. I think so many
Portfolio
people.
careers?
Yes, portfolio careers, it's essentially the idea that, you're not one career path. You're not going to go to school and become an engineer and work as an engineer your whole life. There are multitudes within you. If you're a multi-talented person or if you're someone who has multiple interests, then a portfolio career makes a lot more sense where it's you see each career path or each job as a project in a portfolio rather than a linear path. Yeah.
Amazing. Thank you so much for joining me
Of
today.
course, of
And I
course.
hope this was really helpful to you guys. Obviously, if there's any questions, please leave it in the comments. Make sure to like and subscribe. I will let Tosin know and we can address even later if you guys want to get even more personalized advice or anything. So thank you for joining us today in another episode of Off Label Careers. This is Savither Kanuri signing off.
Bye.